when it comes to some of these comorbidities, what is your process when it comes to cross specialty collaboration and communication? How does that impact your work, and what do you hope to see in that in the future?
Yeah, awesome. So, really fortunate here that at our metabolic liver clinic, again, very multidisciplinary. So, dietitians, are part of our team, hepatology obviously as well, and then bringing into the fold endocrinology here too. So we can have a multi-headed approach to managing all these patients' comorbidities. It's not uncommon that we send patients to each other for management of very difficult to control diabetes or concern for advanced fibrosis and vice versa. And now that we have a very collaborative setting, we're all in the same room taking care of the same patient in the same clinic session. We can really give a very focused and tailored approach to each patient, discuss the best drugs to manage all these comorbidities, to manage their MASLD, their MASH, and find the right options for them.
Um, with recent FDA approvals for things like F2, F3 fibrosis, resmetirom specifically, and semaglutide, are there any practical barriers to getting these agents to patients with advanced MASH, and how can health systems or advocacy overcome them?
Yeah, I think several, at least, tools from our experience here. Really fortunate to have a wonderful group of specialty pharmacists who really fight for these patients, for approval, for these medications. A lot of there's the industry also is interested in being able to give access to these patients as well. So when and where we meet barriers, they're very receptive to being able to help provide options to us to be able to help give the medication to patients.
Mhm. Are there any new side effects or adverse events that are emerging with these new emerging treatments? And how do you modify your counseling or monitoring of patients with advanced scarring versus earlier disease when they are receiving these new treatments?
Yeah, so the biggest thing with the GLP-GIP therapies have been gastrointestinal side effects. For some patients, they can develop severe nausea, intolerance to oral intake, symptoms of satiety, bloating, fullness that just make it really difficult to continue on these medications. For the right patient, especially if they've been on a higher dose, potentially just weaning down, assessing response and tolerability to a drop down dose would be kind of the first step to assess what they can handle and continue to minimize these side effects. Similar to the resmetirom, mostly gastrointestinal as well, which, if an option, dose reduction, since it's given by weight-based dosing, is very frequently the first step that we take to try to see if they can better tolerate the medication. And if not, obviously, discontinuation or alternative options have to be on the table as well.